So let's talk a little bit about draw sheets. Now the draw sheet is basically a smaller sheet that you put over the middle of the bed. Now normally it is going to be cotton so that it'll dry out quicker and stay clean and dry. Sometimes we do use a plastic draw sheet because it's waterproof. And the only problem with plastic draw sheets are, some of the ones that we use, those pads, will be washable, but you also have some that are disposable, that are more disposable, but those are very expensive. So we don't usually use anything disposable like that in a long-term care setting because, it's not as cost effective. So the plastic draw sheets are waterproof to keep the mattress and anything underneath it from getting wet. But we always use a cotton draw sheet. Whenever you have a plastic draw sheet, you put that cotton one on top. We don't see that a whole lot around here, but that is something that could be available. And again, most of the time you're going to have cotton draw sheets without the plastic. Okay. Now, again, we keep stressing the medical asepsis. If you know that you're going to be in contact with a body fluid or blood or anything, make sure you're taking the precautions that you need to protect yourself. Now, again, while you're making the bed, you have the closed beds for the ones that are going to be out of the bed most of the day for your new residents. Okay. Now, if you fan fold those top sheets and linens together, you have your top sheet, you have kind of the blanket or whatever they want on top of that. If you fold it all the way back and back over top, called a fan fold that we kind of worked on earlier when we were working on bed making, then that turns it into an open bed. Okay, super easy to transform that. And just fan fold that back, especially if you have someone who is newly admitted and is going to be in a wheelchair. They're going to want to go straight to their bed, or they're getting ready for bed, or they're going to be out of bed for just a short time. Okay. Now, if you have residents that for whatever reason can't get out of bed, then you are going to have to make an occupied bed. Now, make sure that you keep your patient in good body alignment. Try to keep them as straight as possible at all times while you're making the bed. Make sure that you follow any restrictions that patient might have. If they've got a cast on, or if they have some sort of diagnosis that limits using one side of their body, you always have to keep that in mind when you're making the bed, and make sure that you are limiting whatever movement or position that they cannot be in. As with everything that we do, we always explain the procedure to the patient. Okay. Now, if you did have a surgical bed that you had to have a transfer from a stretcher to the bed, again, if they're coming back from an ambulance, or if you're having to send them out on a stretcher via ambulance to the hospital, we don't use a lot of portable tubs, so I don't foresee that happening around here. But of course, every last thing that we talk about when we talk about a resident is quality of life. Make sure that the beds are neat and clean at all times. And if you have visitors come in, families come in, and they see the bed looks messy, they feel like their family member's not getting taken care of. Okay, they feel like it looks sloppy and careless, and they feel like maybe their family member really isn't getting very good care. So that even just a simple bed making says a lot about the care you take for your residents. And again, if you have a resident who has a favorite blanket, maybe they like quilting and they've made these quilts and brought them from home, let's try to use whatever they pick out. Give them a choice and what kind of linens you put on their bed if possible, and because that allows a better quality of life. So any questions about bed making?